Afternoon. My name is Ron Aaron Eisenberg, and I have the honor and privilege of being your host for today's Global Pain Association Chronic Pain Education Series. We have been doing these programs since May, and I have to tell you the response has been fabulous. I've got a history of emceeing and hosting a number of these types of programs. I've been a talk show host for decades, and very little that I have done compares to the excitement, enthusiasm, and the amount of information we're able to share through these virtual chronic pain education programs. And today, we've got a very, very special program. I encourage you in the next minute or so, if you want to share this broadcast, and you can do that on Facebook Live at the Global Pain Association page, share this because it deals with suicide, something that is not talked about enough in our society, and yet is a very real and very serious threat to literally thousands of people. The topic: depression, suicide incidents, and chronic pain. And our guest is Dr. Melissa Duder, who is the founder of Sigma Mental Health Urgent Care, and we will talk with her in just a moment. But first, I want to tell you a little bit about our sponsor for this week, Restore Bioscience CBD. The founder and CBD coach has multiple autoimmune diseases. She's struggled with pain, fatigue, anxiety, sleeping issues. The highest quality oil is used and is physician vetted, made in the USA in a registered FDA facility, compliant, certified, and a certified manufacturer. Restore Bioscience CBD is a double third-party lab tested for concentration, pesticides, molds, bacteria, viruses, heavy metals, and any contaminants, all the stuff you don't want in there. Go to their website at www.restorebiosciencesus.com. And at the end of the program today, our sponsor is offering a 20% discount on all CBD products. Listen for that code at the end of the show. So you got to stay through the show to get that code if you're interested in that 20% discount on all of their CBD products. It's a pleasure, as we do every week in launching these series, to introduce Dr. Susan Blackwood. Dr. Blackwood is president of the Global Pain Association, has a long history in working with community groups and others in this community in which we live, and launched a program designed to help literally thousands and thousands of people. Susan Blackwood, good afternoon.
Hi, Ron, and thank you for moderating this incredible series again, and to the Eisenberg Group for producing it, and Biosciences. I've got my own bottle here with their sponsorship of this incredible segment today. We are now reaching about 34,000 followers with the series that started in May. Our board has voted to continue these series in the fall, bi-weekly. And so we're hoping that people will send in topics that they'd like to have, including things that they've already maybe heard that we want to repeat. We couldn't be doing it without people on our board and the other volunteers that have really, really stepped up to make this series possible. People can get involved, and I'll talk about that later as well.
Susan, we will catch you, and thank you very much. And we're going to turn to our very special guest. But first, thank you to Patty Shackelford Larson, who has already shared this broadcast. We encourage you, please share this with others, because the topic of suicide is so critical and so important in our community. Dr. Melissa Duder is with Sigma Mental Health Urgent Care. She is board certified in psychiatry, based in San Antonio, and founder of that organization, Sigma Mental Health Urgent Care. She currently holds an appointment as clinical assistant professor of psychiatry at UT Health. Dr. Duder is the former president of the Bexar County Psychiatric Society, a current member of the Texas Society of Psychiatric Physicians Ethics Council, and a current member of the South Texas Psychiatric Physicians Research Network Executive Committee. Dr. Duder is the author of Stuck. Man, I like that title. Stuck in the Sick Role: How Illness Becomes an Identity and a Vision for Change. How to help someone with addiction or mental illness. And it's a pleasure, Dr. Duder, to welcome you to the Global Pain Association Virtual Education Series. Thank you for giving your time to us.
Thank you. Thank you. I'm glad to be here.
Why is it that suicide is something you wanted to talk about? Nobody ever talks about suicide.
Sure. Well, I'm a psychiatrist, and part of my specialty is to work with people who have issues like suicide. And I think the Global Pain Association and your focus on people with chronic pain, there's a real intersection there between your work and mine.
In your practice, I'm sure you have seen people who have contemplated suicide. Are they open about it, or is it something that you have to pry out of them? And if people dealing with chronic pain, they've got enough in their life to worry about, why would they talk about suicide?
Yeah, those are good questions. So some people are very open and some people are less open. And you might have to pry it out of them. And so, it is important to talk about. And one of the things that has been looked at in people with chronic pain is that there may be higher rates of depression if you have chronic pain. There may be higher rates of suicidal ideation. And so it's really important for healthcare professionals and supportive people who are working with individuals who suffer from chronic pain to ask them if they're having mental health symptoms and if they're having suicidal thoughts.
Now, you made us aware of a study done by the Center for Disease Control showing a marked increase in suicide in people with chronic pain from 2003 to 2014. What is that all about?
Yeah, so there appear to be some shared neural networks between the pain processes in the brain and the mood disorder and depression parts of the brain. So in other words, if you have heightened activity in these brain areas because you're suffering from chronic pain, it also increases activity that's associated with depression. And so that's one piece, is the brain activity. Another piece is that people who have chronic depression, they experience more problems from their pain. And so if you're already suffering, you're already hurting or hopeless, or seeing things maybe in a negative light, then your pain is more distressing. You have negative expectations in that case about your pain, and it really just makes things worse. So it's very circular, right? Depression makes pain worse, pain makes depression worse, and it really does kind of heighten the situation for people who suffer from both problems.
And yet we know many people who are depressed commit suicide, but not everybody who's depressed goes ahead and commits suicide. What's the difference? Why some, why not others?
Right. Well, and the answer to that is not completely known, but suicide and depression don't really always go hand in hand. There are a lot of people, far more, who suffer with depression that never have any suicidal thoughts or act on any if they do. But also some people who've never actually had depression may have suicidal ideation, because suicidal ideation can come from hopelessness and despair. People can have a heightened risk for suicide if they have a different mental health diagnosis, like an eating disorder, a bipolar mood disorder, or schizophrenia. So it's not really a one-to-one in the way we sometimes think.
One of the things that surprised me in looking at the data that you provided us, you take a look at since 2006, rates have increased more sharply among those who are in the 35 to 54 age range. That's not very old. And the second leading cause of death for 10 to 34-year-olds is suicide.
Right.
You're saying this, that's crazy.
Right. Well, the suicide rate has been on the rise, and there's a lot of research attempting to understand the reasons why. And suicide can affect all age groups, adolescents, young adults, middle-aged individuals, and older adults all have different risk factors that may contribute to an increase in suicidal thinking or suicidal action.
I was taught, I used to have the Rape Crisis Center here in Burke County, as I think you know, and went through suicide prevention training, ways in which to identify someone who may be contemplating suicide. And one of the things I was taught is it is important to bring it up to someone who has talked about suicide and not to avoid it. The old feeling was, if I tell them, hey, are you thinking of suicide? I'll make them do it. Not true.
Right. Not true, not true. And this has really been looked at. That question was looked at very closely because these are the concerns that people have. And it turns out that if you ask someone, are you thinking of suicide? It does not in any way put that idea in their minds. If someone is at risk for suicide and they're thinking about it already, being asked gives them a sense of relief. It allows them to talk about it and be open and feel comfortable and safe. And if a person has never had suicidal ideation, having a discussion is not going to put them at risk or put that idea in their mind.
What about joking about suicide? The other thing I was taught is that if somebody kind of jokes about, I think I'm going to end it all. I'm going to take my life. And if it looks like they perhaps have done some of these things on this chart, take them seriously.
Yeah, I think that's absolutely right. And joking about suicide is something that I think needs to maybe be kind of tuned into, more questions asked, because you do see that some people will make jokes or make light of the subject as a way to maybe introduce it into the conversation. If people are, going through a difficult period, they're having a depression, they're having health problems, maybe they're recently divorced or had a breakup or drinking alcohol, and they're making these kinds of jokes at a higher rate, that really should get our attention and we should talk to that person.
Now, on this warning signs of suicide, you talk about behavioral changes. And one of the things that I thought was pretty significant is people who begin putting their life in order, giving away things, simplifying as perhaps a warning sign.
Right. And that's a well-established warning sign. So when individuals have kind of made the decision that they might go ahead and go forward with a plan to take their own life, they might start to take important things, valued things, and try to put them in the safe hands of a loved one or significant person in their life. And that really should be regarded as a strong warning sign.
Now, you had talked earlier, Dr. Buter, about the correlation between pain and chronic pain and suicide. What is it that makes pain a risk factor for suicide?
Right. Well, there are probably two different parts. One is that chronic pain can leave a person feeling hopeless. An individual can begin to feel like things will never get better, that there's nothing that can be done, and they may want a way out or an escape. So that's one way. But another is just the shared biology in the brain, that chronic distress and a chronic problem to deal with, a burden in that way, can light up certain circuits in the brain and correlate depression and suicidal ideation with pain.
In part of the things I do professionally, I host a couple of radio shows involving seniors and Medicare eligible folks who are in their 60s and 70s and 80s and have come to learn, and you confirm this in the statistics we have from you, that especially white males 65 and over are at greater risk for suicide than almost the rest of our population. Why is that?
Yeah, that's a really interesting thing, because I think that a lot of lay people believe that suicidal ideation might affect older white men maybe less, but that's actually not true. And so retirement, loneliness, loss of job, loss of income, a sense of failure, all maybe disproportionately affect men. And that may be because men are not opening up and talking about their feelings. It may be because men might reach for a more lethal suicide attempt if they do attempt, and they may not talk about it at all. So we really see a disproportionate heightened risk in that group.
Yeah, I was going to say, and I don't mean to make light of it, but the tragedy is a lot of older men turn out to be very good at killing themselves because they reach for weapons, guns. And if you blow up your head, you don't come back.
Well, and that is, I mean, if you look at the data, men are more likely to reach for something like a weapon in that way, whereas younger individuals and women are more likely to try something that's less likely to be lethal. And, I was taught in my training that a suicide is a violent act, and you have to be a person who can muster the courage and energy to want to commit a violent act. And so that may be the association that people make. And I see here we have on the screen the National Suicide Prevention prevention hotline. And I think it's really important for people to record this number, put it in your phone, and call for help if you're having thoughts of suicide.
We've got about a minute or so left, and I don't want to leave without asking you if there isn't something we haven't asked you that you'd like to talk about.
I think the one thing I'd like to say is if someone you love or care about is threatening suicide or is acting in a concerning way, to call a crisis line and seek advice and ask specifically, how can I be of help to this person? Is this an emergency? Do I need to call 911? What support can I get in order to help someone I care about who I'm worried about suicide for them?
If folks would like to talk with you and make an appointment at your office, you and I talked about you'd be certainly willing to talk with folks.
Absolutely. Absolutely.
How do they reach you?
Yeah, so my office is in San Antonio, although we do have virtual telehealth services throughout the state of Texas. And the telephone number listed here, 210-314-4564. And then our website, sigmamhuc.com, and our email address here. And people can go and just look us up and see what we do. We take same-day appointments 7 days a week, except major holidays.
Well, I thank you so much for coming on. And I think you're going to make a big difference in people's lives who have a chance to see this program. And Melissa Duder, thank you so much. You've been a great, great guest.
Thank you. Thank you for having me.
You take care. Bye-bye.
Okay, bye-bye.
Dr. Melissa Duder, Sigma Mental Health Urgent Care. This week's program was sponsored by Restore Bioscience CBD. The company uses high-quality oil, uses award-winning non-GMO plants, and is organically grown and processed. It is a physically vetted program those products are made here in the USA in an FDA registered facility. Restore Bioscience CBD gives all new customers a free consultation by a certified cannabis CBD coach who will stay with you on your journey. They also are offering a show special code for watching for a 20% discount. If you made it this far into the program, here's the code: GPA20. GPA20. Enter that code on the website or toll-free number, and you will get a 20% discount on your purchases. www.restorebiosciencesus.com or 866-479-6646. And we thank them very much for their sponsorship. It's time now, as we do with every one of these programs, to welcome our founder and the mother to all of us, Dr. Susan Blackwood, who serves as the executive director as well of the Global Pain Association. And Susan, that was a fascinating presentation.
Oh, the statistics were overwhelming. I mean, I'm bewildered. And as much as we know that it's a problem, until we have somebody with her professional expertise to really present the facts, the cold facts, unfortunately, it's just hard to understand. But we, probably all know somebody that has either attempted or has committed suicide. So understanding the real facts behind this and how to get people help is so critical, especially to our chronic pain patients and their caregivers. We really can't thank her enough for her time and commitment, as well as you and the Eisenberg Group for producing this each week. It's just been wonderful. And to the bioscience, Restore Biosciences, CBD, we thank them for being a sponsor. And we encourage people to get involved with this. They can go to our website, globalpain.org, hit the tab that's get involved, either be a volunteer or even donate. And no donation is too small. We really need to keep this series going. Our board has been very active in fundraising, but we need the people that are watching this and sharing this to help continue to support the series, especially this fall and into the late winter.
Now, they're also available on the Global Pain Association Facebook page for folks who want to listen again and who want to share them with others.
Like the 34,000 people that have already done that and have benefited from those being live on our Facebook page forever.
Well, we encourage you, if you are listening to us at this moment, to go ahead and share this program. and you will be helping others. And you may not realize it. You could be reaching somebody who has been thinking about taking their life, and you may be the one who gets them to reach out for help. So we encourage you to do that. Susan Blackwood, thank you. Thanks for putting this program together and for your support. We're going to talk about what's coming up next week. And if you join us next Saturday, August 29th at noon, right here on the Global Pain Association Facebook page, a discussion of support groups. And frankly, they can be incredibly powerful tools for helping people deal with chronic pain and other issues that may be affecting their lives. So that's next week, Saturday, August 29th at noon, support groups. And remember, the National Suicide Prevention Lifeline, 800-273-8255, 800-273-8255. Thanks, everybody. And we'll talk with you again next Saturday at noon, right here on the Global Pain Association Facebook page. Have a great rest of your weekend.